All right, and now I'm going to share my screen so we can get started. And again, you can always use that chat function at the bottom if you have any questions or need some clarification. But we'll go ahead and get started. We have a lot to cover this morning. First, thank you so much for taking the time today to join us and to be part of the Grant Writing Workshop to learn a little bit more about our 2020-2021 request for applications, which is now available on our website. We're going to go over a few different things. We'll do an introduction, some background information, an overview of the grants process, and the community profile. There will also be an introduction to our new grants portal, which will give you some screenshots and show you what you're looking for when you're using the grants portal. We'll go into a little more depth about that. Some tips on grant writing and how to write the best application for our reviewers, and we'll do questions at the end. So we'll go ahead and get started. This is me. I am Ryan Tollefson. I'm the Community Health Manager. I think I know many of you that are on the phone already, but I work out of the Newton, Massachusetts office for Komen, New England. I'm in charge of any education and outreach initiatives, grant management and compliance, and advocacy and public policy for the affiliate. So if you have any questions about any of those, please don't hesitate to reach out at any time. Many of you are probably familiar with Komen, but just to give an overview, Komen is the world's leading nonprofit breast cancer organization, and we have a comprehensive 360-degree approach to fighting breast cancer. We do that through our community grants program, through our research initiatives, through our treatment assistance fund, through education and policy. We advocate for patients, we drive research breakthroughs, improve access to high quality care, which is where you guys mostly come in, offer direct patient support, and empower people with trustworthy information. Many of you are probably familiar with this, but in 2016, Komen announced our bold goal, which was to reduce the number of breast cancer deaths in the United States by 50% by 2026. We know that actually without any new research breakthroughs, we can get there. The big barrier is access to care, which is where our community grants program comes in. And anything that we do through our community grants program rolls up to this bold goal of reducing the number of breast cancer deaths. So our community grants aims to reduce breast cancer mortality in a couple of different ways. We look at addressing disparities in care, increasing access and to quality and timely care, and improve patient outcomes through patient navigation. Komen, New England is the local affiliate. We tend to think of ourselves as a franchise. We have an independent board of directors for our affiliate. Like I said, we have an office in Newton, Massachusetts, and that's where I'm based out of. We also have folks in Vermont and Connecticut as well, but we serve all 6 New England states. And we've invested more than $31 million in community programs like yours. So when you're looking at the request for applications or any information that you see from our affiliate or from Komen in general, we talk a lot about the breast cancer continuum of care. Many of you are probably familiar with this, but we want to ensure that every person that we interact with is able to get into the continuum of care and is able to stay within the continuum of care until whatever the end result is for them. So we start with education, and we want education that leads to action. So screening, if there's an abnormal result, follow-up, diagnosis, treatment, leading back towards follow-up and survivorship, depending on that person's particular journey. But we talk about the continuum of care and want to ensure that the folks that we are interacting with are able to get into the continuum of care and stay within it. Our community grants process kind of looks like this circle here. It's an annual process. And it starts with learning from the community profile and our mission action plan. For those of you who have applied in the past, you are likely familiar with our community profile. You can find it on our website under community profile. It was written in 2015. We will be rewriting it within the next year or two. We're still waiting on the timeline for that. But this is how we make decisions about where our funds can make the greatest impact. So we learn from the community profile. Based on that, we develop and issue the request for applications, which was released on October 1st this year. We are here, we're holding the Grantwriting Workshop. Once applications are in and the application due date is December 3rd, I conduct a compliance review. So I look at all of the applications we receive and ensure that they're asking for funding for things that we have stated we will fund through this RFA, to ensure that all of the needed materials are there, all of the questions have been answered, and all of that. And then it goes to our independent review panel. We have a review panel that's made up of experts in the field. We have folks from departments of health. We have navigators. We have breast cancer survivors. We have patient advocates. We have physicians. It's a really diverse group, but they are all familiar with the breast cancer landscape in their area, and are all really, it's a wonderful group of people that review our applications. They are the ones that determine the grant slate, which is presented to the board. So it's not Komen staff, it's not Komen board members, it's the independent review panel that read and review the applications. I'm there to provide guidance, but it's not my decision. It then goes to our board for approval. And from there we go into awarding grants and executing contracts. That will happen in March. We typically have decisions available by, we aim for the second week of March generally, and then grants start on April 1st or whenever the contract has been fully executed by both parties, the grantee and Komen New England. And then we go into managing and monitoring the grants. For those of you who are or have been current grantees, our affiliate really likes to work together as a partner with our grantees. So there's communication throughout the year. There's usually a site visit. There are progress reports and final reports as well. And then we evaluate the impact. We take the information we've received from each grant cycle. We look at the services performed. We look at where those services have been performed, the demographics that we're reaching, and evaluate how we are making progress towards our mission action plan and our community profile. That's just a general overview. Some important dates to keep in mind. The grant application deadline is December 3rd. It's at 11:59 p.m., so you just have to get it in before December 4th comes. Of course, the earlier the better. That is the week after Thanksgiving, and I know it is a very busy time of year for many people, and lots of people are on vacation, so feel free to get that in early, but December 3rd is the deadline. We will not accept any applications after December 3rd. Like I stated, the applications are reviewed by the peer review panel, and that happens in January and February. And then the slate is approved by the board of directors. It's generally the end of February or early March is when they have their meeting, and grantees are notified in mid-March. The first check will be issued following execution of the grant, of the contract. We have 6-month progress reports, which are due November 13th of next year. Site visits happen in the fall. There's a deadline to request a no-cost extension if for some reason your project is not completed or is not anticipated to be completed within the 12-month time frame that you have. And then final report and return of any unspent funds would be due in May of 2021. So as I mentioned, our community profile is the document that we use to determine what it is that we do, what it is that we fund, and how we do that. It's an assessment of breast cancer and breast health services throughout our service area. All 6 states are included. And it's to ensure effective and targeted efforts towards reducing breast cancer mortalities in our area. It's a rigorous collection and analysis of data. It's both quantitative and qualitative data as well. There is an executive summary that I would definitely encourage you all to read as you're writing your RFA. You can find it on our website as well under community profile. The community profile itself is 120 or so pages, so you may not be able to get through all of that, but I would absolutely encourage you to look at the executive summary for that. Based on the 2015 community profile, we have some target communities, particularly in Connecticut and Massachusetts. In Connecticut, it's Hartford, Litchfield, Fairfield, New Haven, and New London counties. In Massachusetts, it's Greater Boston, Worcester, and Springfield. Greater Worcester, Greater Springfield. That doesn't mean that we won't accept applications outside of those counties or areas. We certainly will look at those as well, but our priorities are these counties or city areas listed here. In Vermont, New Hampshire, Rhode Island, and Maine, we do not have targeted areas at this time for this RFA. So within the RFA, you'll see we have 3 funding priorities. The first is patient navigation. The second is reducing barriers to care. And the third is breast cancer education with follow-up. These aren't listed in any particular order. We're looking at funding things in these 3 categories. And they're fairly broad. Patient navigation, we are specifically looking for the evidence-based practice of having a navigator take a patient through each process within the breast cancer continuum of care. That looks a little bit different in many of our organizations that we work with, but as long as you fit the definition of patient navigation, we would certainly consider that application. Reducing barriers to care is broad. That could be funding for screenings, diagnostics, treatment services, financial assistance, emergency funds, things like that. There's quite a variety of things that fall in there. And breast cancer education with follow-up, Komen will no longer fund health fairs, education fairs, things like that. We are looking specifically to fund education that leads to a documented action that is appropriate to that individual. And if you are looking for funding for breast cancer education, just keep in mind that you will be asked to track the metrics that come from that education. So that's kind of impossible if you're, tabling at a health fair, for instance. Like I said, we're not going to fund that those efforts with this RFA anyway, but you do have to keep track of folks that you have educated to see what those follow-ups are. You can get more information on each of these funding priorities within the RFA as well. Like I said, we are looking to fund evidence-based practices that have been shown through scientific research to consistently improve measurable outcomes. And you can find more information on evidence-based practices and definitions, things like that, on the resources here, the communityguide.org, the National Cancer Institute's research tested intervention programs as well. You can Google that, and the Cochrane Library. The links are there, and like I said, this will be available on our website afterwards if you did want to look into those. And if you have any questions, you can always reach out to me and let me know at any time. So the eligibility requirements, and I see we have a couple of questions. I will get to those at the end. Eligibility requirements, individuals are not eligible to apply. Nonprofit organizations with 501c3 status or governmental organization with 170c1 status serving residents of those targeted areas that we mentioned before are eligible to apply. And eligibility requirements must be met at time of application submission. So if you are in the process of obtaining 501c3 status, we would not be able to accept that application unless that has been done at the time that your application has been submitted. There's more information on eligibility within the RFA as well. Allowable expenses. So we do provide funding for key personnel and salaries directly related to the project, consultants, subcontracts, supplies, travel, patient care, some equipment, and indirect costs, which cannot exceed 15% of direct costs. And there's a full list in the RFA. There are also a few funding restrictions. Our community grants program does not fund research at all. There's a separate Komen Komen headquarters research program. We do not fund education regarding breast self-exams or use of breast models. And if you do use breast self-exams or breast models in outreach or education, whatever that is, please keep that out of your Komen application. Like I said, Komen is looking specifically to fund evidence-based practices. Most of the breast cancer organizations have moved away from using breast self-exams and breast models as they are not evidence-based practices. I can give you more information on that if you need it. Just keep that in mind, that is something that we will not fund. If you are looking to develop education materials or resources, they need to be separate from something that Komen already has. We do have quite a wealth of education and resource materials that you can find on Komen's website. I can direct you to that if you have any questions on that. But if there's a demonstrated need for an education material or resource and it does not currently exist, it's something that we would consider funding, but nothing that is a duplicate. And education via mass media, health fairs, and material distribution is also in the restricted list. Again, this is not the comprehensive list. You can look in the RFA for more information, but those are important to mention. The funding caps are different by state. So this is an important thing to look at when you are writing your application. In Connecticut and Massachusetts, we will fund applications up to $45,000. In Vermont and New Hampshire, it's up to $20,000. In Rhode Island and Maine, it's up to $15,000. We base our caps and our grant capabilities on how much is fundraised in each state. So funds that are raised in Connecticut and in Massachusetts primarily go to Connecticut and Massachusetts for community grants programs. Same in the other states, which is why those numbers are a little bit different across the board. So some grant policies. The project must occur between April 1st of 2020 to March 31st of 2021. But no expenses may be accrued against the grant until the contract has been fully executed. And in my experience, this can take a while between going through insurance requirements, legal offices, things like that. It is not unheard of for it to take 6 weeks for this to happen. So just keep that in mind as you're going through the process. Grant payments are made in 2 installments pending acceptance and compliance with the terms and conditions of the grant contract. And you may request 1 no-cost extension of no more than 6 months per grant. This is something that often hangs up the grant contract process. If awarded, a certificate of insurance is required, and the grantee is required at minimum to hold the limits listed on the slide. It is also in the RFA, so you can look at that as well. I would definitely suggest making sure that this is something that your organization can agree to in advance so that you don't have that holdup if you are funded. Because this is definitely a big point where things get held up. And if you have any questions about it, feel free to reach out to me. I'm not going to go over this in depth again. Education materials, we only fund projects that use education messages and materials that are consistent with Komen messages. So you can take a look. There's a website listed, komen.org/breastcancer/breastcancerawareness.html, where you can look at these messages. And again, we will not fund education projects that use monthly self-breast exams or breast models. So all proposals must be submitted online through the Komen Grants portal. The website for that is komen.smartsimple.com, and applications must be received on or before December 3rd. Just keep in mind that that is the week after Thanksgiving, so it is always a busy time of year for everyone. So just keep that in mind when you're doing that. When you are going through the application, you'll see in the RFA and in Smart Simple, you'll see there's a couple of different areas. There are a few questions and some text boxes to fill out. The first is the project narrative, and here you include your statement of need, your project design, your partners, and how you will sustain the project, and how you will evaluate the impact of your project. This is really the first thing that the reviewers read. So you want to make sure this is clear, it's concise, it's not overly wordy. Keep in mind that our reviewers are reading a lot of applications, so you want to try to be as clear and concise as possible so that they are able to focus and give it all of the attention that they need. This is all going to go into the project narrative section. In past applications, you've seen a goals and objectives section. It's now just project objectives because everything rolls up to the bold goal that I mentioned earlier of reducing breast cancer mortality. So you will list your project objectives, and you have a number of different boxes to do that. Your SMART objective, you want all of your objectives to be SMART, and you can look in the RFA, there's the definition, and I'll give you some examples as well. So you put the objective there, your anticipated completion date. For most of these, that's going to be the end of the grant term. Your anticipated number served, and the service type, and those are that's a drop-down box for you to fill out. SMART objective examples would be something like, by September 30th, 2020, PINK organization will conduct 10 group breast cancer education sessions reaching at least 200 Black African American women in Greene County. So it gives you dates, numbers, who's going to be there, all of that information is within that objective. Another example would be Northern Region Hospital breast cancer patient navigators will reduce the average time from abnormal screening mammogram to diagnostic conclusion from 65 days to 30 days for women in the counties of X, Y, and Z. So those are just some examples of how to think about writing those objectives. When you're thinking about writing these objectives and filling out your application, keep in mind the reporting metrics that are listed in the RFA. You're going to report on the demographics of the folks that you have served. When you are reporting back on your progress report, it's going to be based on what's in the RFA. So you want to make sure that you're really clear about the services that you are planning to provide. If, for instance, you are planning to do diagnostic services, you want to kind of break that out into what that's going to be. Obviously, there may be things that shift during the course of a grant. Funds may need to be moved from diagnostic mammograms to ultrasounds, whatever it might be. That's fine. You just want to make sure that you're as clear as possible in what it is that you're planning to do. There is a budget section, and when you're going through the application, you'll see a total amount requested right on one of those first pages, and we'll look at what the pages look like in a little bit. That's going to populate from what you put in further forms where you kind of lay out how many services will be provided and the cost per service. Again, these are the items that we will fund: salaries, patient care, consultants or subcontractors, supplies, travel, indirect, and that all, once you have populated all of those line items, it will automatically feed into the total amount requested that you'll see on your kind of main page for your application. There are a couple of supporting documents. This is something that people often forget to upload, but they are required, so please upload them. so I don't have to come back to you in December and ask for them. We do need proof of tax exempt status, and you're going to upload that in the organization information. Letters of support or partnership or a memorandum of understanding, you're going to put that within the project partners. So if your organization refers people to another organization for whatever service or however that might be, we need to know that and have a letter, a recent letter. Please don't upload things from 2011. And we also need, under key personnel, if those are folks that are directly dealing with the day-to-day management of your project, so your patient navigator, your nurse navigator, whomever it is that is dealing with on a day-to-day basis, we need either a job description or a resume. If you have not hired that person yet, then we need the job description. If that person is in place, then the resume, please. And that goes under the budget key personnel. One big change that you will see with this system is the way that things are submitted. You no longer need multiple logins per organization to go through the process. There is no longer an authorized signer who needs to have a separate login. The project director, who is known within the grants portal as the organization contact, can submit the application after uploading a signed submission form. So what you will see when you're going through Smart Simple is a download authorized signature form. You can download that. You can sign it if you have a way to sign the PDF electronically and save it, or if you print it and sign it and then upload it. However, you can do it within your office. You're just going to actually upload the document. So you don't need somebody else to go in and change the status anymore, as we've done in the past. I'm hoping that this will make things a little bit easier for folks to get things submitted. And like I said, if you have Adobe software that allows you to just insert a signature on a PDF, you can absolutely do that without even having to print it. So the review criteria, when our reviewers are looking at applications, there are 4 main questions in the applications this year. We've reduced that. There were 6 for the past couple of years. Each area, each question is worth 25%. So all of the questions are evenly weighted this year as well. So reviewers look at each question and score each question within the application. And like I said, there are 4 this year instead of 6. Statement of need, project design, partners and sustainability, and impact and evaluation. The reviewers look at those questions on a score from 1 to 7, 1 being poor with no strengths or major weaknesses identified in the answers to that question, and 7 very strong with no weaknesses identified. Each reviewer scores each question based on this 1 to 7 scale. Very few applications get 7s, and that's okay. But most of our applications do fall within the satisfactory to excellent. But just so you know how the applications are scored, this is the rubric that they use. And like I said before, compliance review happens first. So if anything is missing from your application, if there's a question that seems like maybe you meant to put that answer in a different area, if something just seems weird about your application, I read them first. I will, send it back to you to ask for clarification, or for you to upload additional documentation or whatever it might be, or change if there's something that you've requested in the budget that we're not going to fund. I will ask you at that point to change that. And this ensures that the applications are completely ready to go to our review panel. And I already talked about who they are. They are made up of folks from throughout our service area as well. There's a minimum of 3 review panels for review panel members that score each application. It's often 4, and then those scores are averaged out. And the review panel meets to discuss the grant applications, and they determine the slate of projects to present to the affiliate board of directors. And the board then votes to approve the grant slate. The board and we won't move things around after the grant review panel has made their determination. We also will only fully fund an application unless there's something that we've already gone back to you and said we won't fund. We don't think, it's not our job to tell you what is the most effective way to use those dollars. And trust that you know the most effective way to use the dollars that are granted. So we won't say, okay, we're going to fund this organization for half of what they asked and this one for 80% of what they asked. It's all or none, basically. Okay, so we're going to go a little bit into the application and information to know on that. I think the most important thing is to read everything. We always end up with some applications that are asking for things that we definitely are not going to fund. So please make sure to read the RFA, and at the very least read the executive profile or the executive summary for the community profile. Again, you can find that under the community profile section of our website. Consider those funding priorities carefully and how you can best fit your project within those. And talk to other decision makers in your organization. Sometimes our best applications are kind of cross-departmental or within a project that is in partnership with other organizations as well. So exploring opportunities for collaboration is something that is always interesting and helpful. And allow time to craft an innovative application that is responsive to the needs in your community. Please don't start the application on December 3rd. So with the abstract, first impressions are important. Like I said, the reviewers are reviewing a lot of applications each. So start off strong, make a great first impression, make a brief statement for your case and how your project will decrease breast cancer mortality in your community. Don't exceed 750 characters, which is about 200 words. So you don't have a lot of words here to go with, and the system will count down how many characters you have left, so you're not guessing at what you need to, how much space you have left. The other important thing to keep in mind is that, like I said, we do have reviewers from throughout our service area, and each state is different. So if you are in a state where you work very closely with your BSEP program, for instance, and explain those partnerships and explain how things work. These are folks who are very familiar with the breast cancer kind of landscape, but may not necessarily be as familiar with how your organization works with other organizations or within your service area. So make sure you're reading as if you're talking to somebody who's brand new and making that compelling argument. For the impact and evaluation, we want to know about changes in behavior, knowledge, attitudes, beliefs because of the work that you're doing, or changes among individuals, providers, organizations, and communities. How are you making that impact? As I said before, we are not going to be nitpicking your budget. We want you to make a project that is realistic. And that is not necessarily the cheapest project. Projects become reality because the central idea is sold, not because the proposal is cheap. So just keep that in mind. And justify your expenses. Make sure if your expenses don't seem in line with Medicare rates or insurance reimbursement rates, explain those so that we can know what's going on. Definitely make sure you cover all of that. So again, read the RFA carefully. I think I've said this like 4 times, but I know I'll get an application where it looks like no person has not read the RFA, so I'm going to say it again. Be innovative, realistic, and specific. Write clearly, use active rather than passive voice, avoid jargon or acronyms. Like I said before, these folks, our reviewers, are familiar, but they're not necessarily going to know all of the acronyms that we use in the breast cancer world. So try to avoid that or explain it, and give yourself plenty of time. I'm going to go into Smart Simple now, which is our new system. When we talked about giving ourselves plenty of time in the past, I would always mention that with our old system with GEMS that many of you are familiar with, we would always run into things where things like GEMS was down on Monday mornings. That's not going to be the case anymore. Smart Simple will not be down for scheduled maintenance every week. They do any backup and data work happens overnight, which is fantastic. So that will hopefully help you all as you're writing your applications. You don't need to worry about being locked out for any amount of time. This is what the grants portal looks like. If this is the login page and the registration page, the website again is komen.smartsimple.com. So going forward, starting with this RFA, everything will live within this grants portal. We will no longer be using GEMS, starting with this 2020-2021 application process. Things will not move over though, so you will want to be sure if you have used GEMS in the past, you can still log in. It will still be available, for probably a few more years at least, to get your historical data. So you can always do that. You can log in, you can download things. If you need any help with that, let me know, because that information is not going to be merged into this new system. So when you start, you are going to just click on that Register Here button underneath the big login page. And like I said, the only role for applicants or grantees in the Komen Grants portal is the organization contact, which was primarily the project director in GEMS. So you only really need one login per organization, but if you do have other folks within your organization that would like a login that will also be working on an application with you, it is possible to share that login, or we can invite that person as well to your organization. The easiest way to do that is honestly just to email me with that person's name and email, and I will get them set up. There is a way for you to do that as well. We can work through that if you need to. And in order to submit an application, you'll need to submit that signed submission authorization form. As I said, you just download, it's a PDF, and you upload it back. The authorized signer does not need to register for the Komen Grants portal. So you really only need one login for your organization, but if you have other folks that help out with the application or whatever it is, that is totally fine. We'll work through that. So before it's possible to complete the registration process and apply for funding, there are some eligibility questions that are prompted. These are the three questions. Is the applicant a governmental, tribal, or nonprofit organization? If you say yes, it will then bring up the next one. Will the project address breast health and or breast cancer? I assume you will say yes to that one too. And then it will say, will the applicant propose funding for any non-allowable costs? The answer to that should be no. So once you go through those eligibility questions, it will bring you to your organization search page. So the organization search page, probably the easiest way to do it is with your EIN number. It pulls the information directly from the IRS database if you use that. You can also search by name or by state, but certainly the easiest way is probably going to be with your EIN number for your organization. We have not yet come across any organizations that don't show up through this search process. But if for some reason your organization is the one, then please let me know and we will work through that. But so far, everyone has found themselves this way. So once you set up your organization and your name and your email address and your password, you will see this screen that says your registration for the Komen Grant Management System has been submitted, and you'll receive an email with a link to set your password and to access the system and start your application. Just so you know, there is a little bit of a lag time between these confirmation screens that you get within the portal and the actual email. For me, it usually takes, I've been finding it takes like 4 or 5 minutes, at which point I've usually forgotten that I was waiting for that email. So just so you know, if you don't get that email right away, it is most likely on its way to you. It might just take a couple of minutes. So once you have logged in, you've registered, you've gotten that email, you've clicked on the link, you are confirmed in there, this is what you'll see when you log into the portal. It'll say welcome and your name, and you can look at your organization profile, which is going to be under this up here. It has a T in the top corner that will have whatever your first initial is. Under funding opportunities, this is where you're going to find the RFA. And this is what the screen will look like then. You will click on funding opportunities. It will show you community grant program. It will have a link to the RFA under the guidelines column. And then you can click on apply now. You'll see the initiation deadline, which is December 3rd. You must initiate your application by the day that it's due. And you will see an apply now button. Once you click on that, you're going to get your organization information. Again, it will have populated from the IRS database with address, that sort of name, address. So that should already show that for you. If it's incorrect, please let me know. You will then go through the questions, any accreditations your organization has earned. If you are involved with your breast and cervical cancer early detection program, that's a drop-down box. It will ask you those questions. I'll ask you about your total annual budget. You'll always see a Save Draft button at the bottom. So click on that as you're going through each page so you don't lose your work. It does not time out the same way that GEMS did. There is, after a period of about 30 minutes, it will warn you that, it'll give you one of those, hey, are you still there boxes. If you're still there, you click on that and keep working. If you're not, it will close down. It's about 30 minutes or so. So just keep that in mind. Hit save. On the project information tab, you'll want to make sure you complete all the required fields, including your project partners, and this is where you will upload those supporting documents, the letter of memoranda or letter of understanding or partnership support letters. That's going to go under the project information page, and again, click Save Draft when you're done. This is what it looks like, so you'll just edit project partners with that tab, attach project partner description, and then you'll select your funding priorities. Many of our projects do fall in more than one funding priority, so select whichever ones are applicable to your project. On the narrative tab, you can always find the RFA PDF. It's in a number of different locations throughout Smart Simple, but make sure you have that and you're looking at it and you're referring to that as you're filling out the questions. And again, those 4 questions are going to be statement of need, project design, partners, and sustaining the project, and impact and evaluation. That's what this looks like. And again, this is the core piece of the application, so please write it so it's easily understandable. Please address specifically what you will do with Komen funding. We know that many of you have funding from other organizations or from your organization, so just be clear about what the Komen funds are going to be doing. And then I showed you the boxes for the project objectives under the narrative, under the project objectives part. You can click on that little box and you can add each SMART objective. So again, they're specific, measurable, attainable, realistic, and time-bound. And you will include your anticipated completion date, anticipated number served, and service type. And then save that when you are done with that page. On the demographics tab, you're going to select your targeted demographics and the locations, the communities within those where you'll be providing these services. Again, click Save Draft. The budget tab, excuse me, you're going to list each of those areas that we talked about that are allowable funding. If you are looking for salary support, you're going to put that there. And again, you'll need to upload their resume, whether they are Komen funded or not. That is something that is required on there. If you are planning to provide patient care with your Komen funds, you will go to Edit Patient Care Budget, and within that you will see sections for screening, diagnostics, treatment, and you'll enter in how many services you're going to provide, what the cost is per service, and specifically what those services are. So you'll enter that. And then you will go to the percentage of project activity, and you'll assign a percentage of proposed Komen funds between the 3 areas: education, screening, diagnosis, and treatment. So the percentage of the project activity must equal 100%. Once you have entered that all in and that all looks great to you, you're going to go to the Approval Form tab and download the Authorized Signature form. So you're going to have the primary contact and the your organization's authorized signer sign those. Again, if you can do it just within Adobe with PDF, do it that way. Otherwise, print it out, have them sign it, and then upload the signed authorization form to under the Approval Form tab. And then you click Submit when the entire application is complete. This is what it will look like under the Approval Form tab, and where you will get that authorized signature form. That authorized signature form will have the full application on it. So if you are giving it to or emailing it to your authorized signer, they'll have everything right there. And then you upload that back in and you hit Submit. Just remember that you have to have that uploaded before you can submit the application, so that you definitely need to have that in hand before 11:59 p.m. on December 3rd. There is a grants portal manual. It is on our website under how to apply for community grants. You can find it linked there. Follow the directions. The manual is pretty good. It does have screenshots, so you can kind of look through and see. It is a new system for all of us, so we'll all kind of be learning as we go, but I do hope it makes things a little bit easier for you all as you're filling out those applications. And also keep in mind that I'm always here for help and assistance, so don't hesitate to reach out if something doesn't seem to be where it should or is not working the way you think it should. Before you get frustrated, give me a call or send me an email and we can work through that. Again, save often. It does log out after about 30 minutes of inactivity. It will warn you that it's about to do that, but just make sure that you're hitting that save button. Like I said, only one user is required, but if your organization would like to have more than one with unique logins, just let me know and we can do that. It's the easiest way is for me to just do it on the back end. There are other ways, and they're again no longer a separate authorized signer. You can also, when you're in the portal, there is a help section in the top corner, so you can always click on that. And my contact information is there, my phone number and my email address. So any questions that you have at all, please don't hesitate to reach out to me. I do have a part-time schedule, so particularly in the afternoons, I am most easily reachable by email. But certainly if a phone call is easier for you, give me a call and I'll get back to you as soon as I can. But I am generally not in the office after about 2:30 most days. And that is what I have for you for this. I'm going to go ahead and take a look at the questions that we have, and I'm going to, you guys can all unmute yourselves if you have questions. Okay. So going to the questions. Yes, so the web link for the community grants process overview is on our website. If you look under KomenNewEngland.org and click on community impact and how to apply for community grants, I'm going to go ahead and share my screen so you can see what I am looking at. If I can fit, there we go. So this is what it looks like. You're going to go to community impact and how to apply for community grants, and you will see the RFA is listed at the bottom under available funding opportunities. It's the community grants RFA listed at the very bottom of the page. So please go ahead and click on that. I'm also, while I'm here, just going to show you The community profile is also under community impact and under community profile. So the information is there. Like I said, the full community profile is 165 pages, but read that executive summary at the very least. Okay, let's go to some more questions. Yes, so for education to a documented action, there's a little bit more of a definition within the RFA for that. It should be patient specific. So it needs to lead to a specific outcome for a patient. So it may be that you are doing, an info session at, your organization, and then you are going to follow up with the 8 women that are at that info session and help them schedule their appointment or whatever it might be for them. So that is definitely how that works, but more information on that in the RFA. Any area for funding eligibility, we are specifically, we do have our priority areas within Connecticut and Massachusetts, but anyone is eligible to apply. The priority areas will be given, a slight advantage within the review process, but certainly anybody is eligible to apply within Massachusetts or Connecticut as well. Let's see what other. There is a word limit on the narrative section. I believe it's, I don't know what it is offhand, but it will tell you on the text box what the word limit is. And it, like I said, it also counts down for you, so you'll be able to kind of see how many words you have left or where you may need to cut some things out. So one of the questions, per organization on Smart Simple, per EIN, yes. So you're going to be registering your organization. The easiest way to do that is through your organization's EIN. If you, for some reason, I don't know that this will come up very often with us, but if you have multiple locations that you are looking for funding for, or if you are possibly also applying for funding through another Komen affiliate, again, I don't think this will come up with within our area, but just let me know and we can work through that as well. To reduce barriers, are there any non-allowed expenses for daily living expenses or transportation? No. So any financial assistance needs, emergency funds, gas cards, bus cards, reimbursement for mileage, childcare, any of those, utilities, things like that. Any of those are allowed within the RFA as well. And I think that is it for questions that I have now. If anyone else has questions, feel free to go ahead and ask. I will definitely stay on the line for a few minutes for anybody. And like I said, if you have any questions afterwards as well, you are always welcome to email me or call me. I'm just going to put up my contact information on the screen again so you have that. That is my email and my phone number. So call or email anytime with more information. Many of the questions that you may have will likely be answered within the RFA, so just read through that as well. But always reach out to me if you have any other questions. Anybody else? All right. Well, thank you guys so much for spending some of your morning with me. Oh, look, I think we might have one more question. Oh, it says thank you. Thank you. You're very welcome. And again, as you're going through the process, please don't hesitate to reach out. We are really excited to receive your applications and read those and review those, and hopefully work with many of you. As you probably all know, it's a competitive grant process, but we are excited to to be able to work with you in reducing breast cancer mortality and addressing those disparities and supporting folks throughout the area. So thank you.